Hello, everybody. So my screen is super tiny, as you can see back here, and I am like having trouble seeing everyone's face, but it's okay. It'll all be great. Um, let's see why.
Is it speaker view?
It's just weird.
Look at
If anyone's super techie and knows how to make the screen not minuscule, let me know. Yeah, I think we'll wait a few more minutes because this is like thrown on you all last minute and it's like attend. And there's one person, two people in person. So,
the view up on the top.
mhm.
See if you can do a different view.
Doesn't say anything.
Well, now go around. See where it says view
This thing?
up the top, right, top right.
Top right.
Well, don't look up there. Look on your.
It's so tiny, I can't see it. Oh,
Is
this.
yeah, that.
Okay.
Oh, Adam's there.
I know, I see
Do
it.
the
Adam's
gallery
face.
or the no speaker there.
Now we all see Adam. All
There
good.
you go.
Okay. Can the other participants introduce themselves? Because I only know Adam and I do know Jennifer. Reza and Moonmin would love to say hi just because I haven't met you yet. Hello,
Hi.
how are you? Okay. All right. I guess. Let's see. Mm. Alrighty. Well, we'll just get it going. Um, okay, so the whoever, I'm not sure who decided. Yes, that we're gonna have a little class on some, they call it clinic etiquette. Basically, what I'm just gonna be going over is how like your interaction with your patients can make their experience better or, make it not so much fun. Oh, let me close this door real quick. So that's for the first half. We're gonna go over just some tips on how to make the patient experience better and also to help you set yourself up so you're not rushing or feeling too stressed during your workday. And I'm gonna try and share my screen and see what happens. Okay. Alrighty, so I set it up in a way that's just simple and easy to go through. All right, so when you come into the clinic, we all know like sometimes we're rushing to get in there, and that does not allow for a fun day when you're trying to rush and set everything up so quick. So always try and come 20 minutes before your shift. And something that really um, makes an impact on an experience for a patient is when they walk into a room and things are organized and clean. It settles people's nervous systems, especially if they're more type A. If you go into a room and you're like that type of personality and everything is just like not organized, things aren't straight and neat, it can feel really stressful. So just keeping that in mind when we're trying to provide a really good experience for all different types of people, having your room organized is really important. Um, things we have here, you can set your linens up really nice so they're folded neatly in the cubbies that we have. You can have like extra little papers organized in a certain way. You can have, um, you know, your needles set up in a nice way so everything just looks presentable and nice. Another thing, this is not, this is a little off the path of just, physical organization. But when you have your space and you're in there, I mean, we all probably, if you came to Yosan for your master's, you took Infinici and you took classes with Ed Sullivan, and he'd always talk about making your room and putting your energy into the room and your um, filling the room with your own chi so that whoever comes in there is not affecting anything because you've already filled it up and you've already put your intention into the room for the day. So sometimes I just like to take a breath and be in the room and just be like, let this space be comforting, let this space be healing. You don't have to sit there for 30 minutes and meditate in the room, but you can um, go in there and just give it a nice intention. I like to think like fresh and bright and positivity and light, just those types of things when I'm putting intention into my room. Um, Next, you would give time to calm yourself and check the mirror, have a drink, maybe a little snack or breath mint before you're like rushing into your day. Because if you just go in there, you like quickly set up your room and then you're rushing off to get your patient. Some people can feel that energy and they notice that it's scattered and it doesn't feel that great. So calm yourself down. Um, Set up your, little station in the break room or papers. I know we use computers now in clinics, so that's new and exciting. But if you need pens or papers, so you're not running around while the patient is there, like in between, you can actually be calm and like sit and really focus on the diagnosis and things. So you're not doing extra stuff. That's always a great way to start the day. And give yourself enough time to read the previous chart entries, especially if it's an established patient that you're seeing for the first time. If a patient comes in and they're like, I told this already to the last practitioner a million times, it's listed in my chart, it's kind of frustrating. So, um, read over what other people have written, or even refresh yourself on what you may have wrote the previous week. Um, Feel free to just interrupt me if you have any questions or you want to say anything, because it's always more fun that way. So step two would be after you've set up everything, I'm just going to walk you through like a kind of like a day and how you would have a shift. So step two would be your first interaction with your patient. This is like the golden ticket to how your session or treatment's going to go. When you are greeting the patient, um, you want to have like a confident handshake, smile, your appearance and your energy like really make a huge impact. So another thing that sometimes people struggle with is pronouncing their name correctly. So let's say someone has a name that you're not sure how to pronounce. You can attempt to say it, or you can walk up to them and be like, I see you're my patient and I don't want to pronounce your name incorrectly. Could you let me know how to pronounce it? That like goes a long way people will appreciate that. A lot of times we're running late. So if you're running late, you want to make sure that you notify the front desk, or if you are, let's say, post school and you're working in your own clinic, sending a text, running out real quick to tell the patient, hey, I'm so sorry, I'm a few minutes behind. Of course, they're gonna be like, it's okay, no problem, you know. But just doing these little things just makes the person feel acknowledged and appreciated, and it goes a very long way. Um, when you're in between that time when you first greet the patient and you're walking them back to the room, you know, sometimes you want to talk with them, sometimes you want to chat. Um, but you don't want to, you know, get into any personal information because that violates HIPAA. We don't want to do anything like that while we're going down the hallway. But having just like small talk, if you know, an authentic compliment, like don't just make one up, but if you really think something about a person, you know, tell them. It can make them feel pretty good, and it gives you a little like chit chat, so it's not this like awkward walk down the hallway to doom, you know, you're having a having some interaction. You know, like, oh, you have such a great smile. You know, just little things like that can brighten a person's mood. And especially if it's their first time getting acupuncture, they might be nervous. So, trying to lighten the mood is always helpful. And type of small talk you can have is the weather. You know, always tell them what room they're going to be in, because in case of um anything, it's good to know. Like I always think in case of emergency and they need to leave or they left something, they can be like, oh, they told me I was in room 16 or room 17. So it's good to tell them what room number in our clinic here. And oh, it's good to ask if they need to use the restroom or get some water prior to bringing them into the room, just in case. It helps with the flow of things once they're in the room. And after you get them into the room, we have hooks on the back of the door. You know, we have little cubbies where they can put their stuff. Help them get settled in and feel comfortable. Um, just offer, like, do you want me to hang your bag up? Do you want me to put your shoes here? Do you want me to um, fold your sweater and you can put it under here in this cubby? And then let them know where they can sit. um, Giving an instruction to a person just really helps them to feel more like confident in how things are going and comfortable in the room. Um, so the next part would be our intake. So although it's our job to figure out the diagnosis and get to the bottom of it, it's also our job to be really nice, good humans and be sincere and caring when we're dealing with patients, because it's sensitive subject material. They're talking about their personal problems and very personal things. So, you know, I've been to many different types of clinics and acupuncturists. Some, you know, they're like, what's your chief complaint? And then ask you a few questions about it. And then they're like, okay, lay down on the table. That is fine in, you know, certain settings, and especially if you're trying to see like 3 to 4 patients an hour, that's all you can do. But, you know, the way you approach those questions, if you have to have a very short intake, can make a big difference. Just taking a time to just sit there first and be like, how are you doing? How are you feeling today? Like, what's really going on? Like, just your demeanor and your energy and your voice can really change the interaction. If you come off a little bit cold or too harsh, or you're not in the way you're asking your questions, you're kind of just very blunt. um Sometimes for some people love that. They're just like, yeah, drill it out and get to the bottom of this and ask me questions. But a lot of people, they take a little time to like open up and trust. So practicing the types of interaction where your energy between you is at the forefront, just making sure like with their body language they feel comfortable. Like you can tell when a person is feeling uncomfortable, you know, they'll cross their arms or they'll look away or they'll look up, they're not engaging with you. So just take those things into account. Um, so sometimes people do not want to share. And they'll be at, you'll ask your questions, how's your digestion? How's your sleep? Do you feel hot or cold? And they're just going to be like one word answers. And they'll be like, I'm fine, I'm fine, I'm fine, I'm fine. So what we've learned is observation. So when you have a tough patient that is not like open to talking about their problems, you have to become the scientist and you have to use all of the other skills that we've learned in school to really figure out what's going on. You're going to check their pulse. You're going to feel their hands and feet. You're going to feel their body. You're going to look at the shen in their eyes. You're going to look at their skin color. You're going to look at how their posture is. You might even do a postural assessment if their main issue is pain or an orthopedic issue. So you're going to really take the time to observe the patient's body rather than just going through our normal questions. You're not, sometimes that's not going to give you um, a real picture on what's going on. Now, there is the opposite of that where you have patients that just don't stop talking for the whole entire time. You ask them how they're doing and they tell you, well, my cat and my turtle got in a fight today and it was really stressing me out. And then I saw that and then there was water everywhere and then I slipped and fell, but that was fine. And then I got in the car and they just go on and on and on. And you're like, uh-huh, yeah, okay. Trying to not be rude and be like, let me ask what I need to ask. Stop talking. Um, so I think some bye, you're good. Some ways that I've practiced like that with people is you acknowledge what they say, you'd be like, no way, your cat did what? And then be like, that is so wow, I can't believe that. And then go and then kind of sneak your next question in. But sometimes that doesn't even work and it's not, you're just they're just continuing and going and going. What I like to do in that instance is just get them onto the table. Like sometimes I'll just be like, okay, that's great. Let's keep talking about that while we get up on the table. I don't want you to lose time from your treatment. And that really kind of sets people into like, oh, I'm going to lose treatment time. So saying, let's hop up on here and I'll get your tongue and pulse, but keep telling me what's going on. Um, it makes them not feel like you're shutting them down. Sometimes with those rants at the very end, you get a aha, like, oh, wow, they've gone through all of that, but they haven't been eating all week. So you never know what's going to come of that. But sometimes trying to cut that out is you just have them get on the table and start feeling their pulse. Be like, my favorite one to do when people are talking, be like, can I see your tongue? Because they have to stop talking to stick their tongue out. So that's always fun. Um, when you're doing the intake, also we're taught we really do want to focus on the chief complaint for the day because, a lot of patients come in and they have a slew of things wrong with them. And they're like, it's this, this, and this. You have some patients that want to tell you, I want to work on my kidneys today, but I also have back pain. And then
Yeah.
I know about my spleen and whatnot. Um, and Yeah, so we have to like keep in mind what's their chief complaint. A question that I sometimes like to ask patients when I'm really just kind of, there's a lot of information thrown at me from them is if you could feel any way today after your treatment, what would that be? And that is one of the most important things to focus on, not what we think is the right diagnosis. You want to really help the patient get what they need from your treatment for the day. So listening to them rather than just being like, oh, well, I see liver chi stagnation and I see, phlegm obstructing the lung, blah, blah, blah. maybe they have those presentations and you can, do something for that as an underlying thing. But if they're just like, I really just want to have more energy, or I really just want to feel like I'm in my body, I don't feel like I'm in my body, or I really want to feel relaxed. I'm so stressed out. I want to stop thinking for 40 minutes. Um, those are the most important things. Another thing that I've recently learned in one of the classes I've been taking in my DAOM was talking about the idea of sometimes a person's body can be stuck in a way, and it's trying to express itself in a certain way. Like we called it, the professor called it like a gesture. So the body is trying to make a certain gesture and have movement through it, and it is our job to kind of see what is going on in the body and help it to move that. Maybe it's, like we say, like release the exterior. Maybe it's to drain damp. But those things also go deeper. So asking the patient what they would like to feel, observing their actual body, I think is extremely important, versus just, going away with questions over and over again, just really taking into account what they're looking like. Like you can tell when a person is fatigued and depressed, their whole body just like caves in. They have like this sunken inness in their face sometimes, or um when some people like looking at someone's body, if they're not transforming damp well, you can see it on their skin. There's like this almost like layer of fluffiness, like a water to their body. They look like they have fluid. So a lot of people they don't know how to tell us that, and our questions might not get to that. So that's why I just really want to emphasize the importance of observing somebody's body and really um, taking that into account. Yeah. So Janice is the only one here, if you guys know Janice. So I'm like just me and Janice having conversation, but I'm also looking at the computer, and it's very funny. So
Hi, Janet.
Alrighty. So, step 4, after you've done your intake and you've gotten all the information, you kind of have an idea what you're going to do. Uh, Something that really helps patients feel calm and comforted is knowing what you're going to do. Um, and giving them really detailed instructions like, okay, I'm going to have you get undressed. We'll need your pants and socks and shoes off. You can use this gown to drape over you. Just a very clear instruction. You're going to lay face up on the table. Your head's going to go on this pillow. Your knees are going to be propped up by this bolster. Like, I don't think it's too much to tell them that. Some people are like, okay, lay down. Like, sure. But if you just go a little bit further and give them a few more steps to what you're doing, or like, yeah, there's a step stool, like instruct people you can step up on the step stool to get onto the table. It just it takes away a lot of like guessing in their brain if you're just like clear, concise, this is what I need you to do. And they can just like lay down and relax on the table, not thinking about if they're doing something wrong. So if you've given them clear instruction, there's not any question in their mind. Um, so once you wash your hands and come back in the room, you have to read like the patient's mood and energy and see what's going on. Like once they're on the table, if it's their first time getting acupuncture, it might be really nice to explain this, like this is an acupuncture needle. What it does when I insert it into your body is it tells your brain, oh my gosh, foreign object into my skin. And now I'm going to start sending help to that area, like on your blood, your nervous system, sending all these lovely things to the needle. And that's how it works. Just like a simple explanation can go a long way. to calm someone's nerves, or tell them this needle is the size of two of your hair strands. It doesn't feel like anything. If it's their first time, maybe start with a point that you know is not gonna like, don't start with like the toes or the fingertips, just hit a nice, spleen 9 and call it a day. But those things are all at your discernment based on like you observing your patient and knowing how they're feeling based on just what they've told you and their body language. If it's a seasoned person, you've seen them 100 times, sometimes you don't even need to do a thorough intake, but I really think the biggest question, just be like, what would you like to feel from your treatment today? Like if you could have anything, if you could feel anything, even if it's grandiose and extreme, what would you like to feel? Um, so if a person, wants to relax, like they're not having acupuncture and then jumping into a car and going to work, some people, they're like, I would like the shades opened. I'd like the sunlight coming in the room, but ask about their comfort level, and you can dim the lights even before you're have all the needles in. I mean, I know some of the treatment rooms here is just like on or off, but maybe leave the blinds open and have that light if it's during the daytime. If it's nighttime, it's very different in the treatment room. So, um, if you need to um, drape them in a specific way, which we're going to talk about in the second half of this class, is draping techniques, like using gowns and sheets to cover them up to get access to certain points that might be not accessible with clothing on, or they just have restrictive clothing. Just really let them know ahead of time. So that gives them time to prepare, like, okay, I'm gonna have you take your jeans off and you're gonna use this gown to cover yourself. And then when you're going into, just be like, okay, before I go and needle these points, I'm gonna undrape your legs so it you can I can get access to these points. Is that okay with you? Just talking them through and giving them a clear understanding of what's going on can really help their brain to just relax, their body to relax, and the treatment to be a lot more powerful when their whole nervous system is already in a calm state prior to getting needled. Yeah, and make a cool checklist and do this because it's really nice. All right, step number 5, be confident. Um, people can tell when someone is new to something or somebody is not confident in their uh in what they're doing. My biggest suggestion, I know when you first start in clinic, it's a little scary because you're like, I have no confidence in this because I've never done this before. But your whole education has prepared you for it. So be confident in that you learned enough to know what to do. And if you have any questions, you can always ask your supervisors. So we've already talked about how some patients like to overshare, and what where confidence comes into that is you being in charge. You're the practitioner and you direct everything in that room. You have the skills to direct how the conversation goes and how everything goes. So knowing that and following that for yourself is really important. And when you come in and you tell them what's going on, you tell them this, and you give them a clear instruction and direction, they really start to um, trust you in a way that um, they're they're trusting that you're going to take care of them. And so the confidence in yourself will overflow onto them, and they will have a better experience overall because they can trust you. So we talked about a little bit patients who don't want to share. So I've had a few experiences in the clinic where I had one patient, he came in and I asked him a bunch of questions, 10 to 15 questions, and he just, no, yeah, whatever. What are you here for? Just to come in. Oh, okay. I was like, okay, let me see your tongue. Dusky, shinier sides, red tip, just stagnation. And I was like, well, that reflects in how he's talking to me. He's so stuck that he just can't even share. So the first thing I did was I just put in the four gates and just let that sit for a minute. I checked back in with him. This guy starts telling me his whole life story. Like, he used to do drugs. He used to live here. He used to do this, but he's been sober for 2 years. He used to like sometimes the needles can get the energy flowing in such a cool way that you don't even need to pry too much. If you just put a few in first and then just be like, how are you feeling? It might just come out. And then you might have to change um, what your plan was to do from there because they really do share a lot more. Um, but again, that's where I said like the tongue impulse really helped. Like, I don't like to use those as my sole diagnosis, obviously, but sometimes those really can help if with a tough patient that doesn't want to express too much. Um, so I feel like this is something that's not talked about a lot in our clinic, what is it? Patient care classes or like clinic theater. There's sometimes people have experienced patients that just are inappropriate and they have inappropriate conversation with you, and that can be a really hard thing to navigate because it feels like your boundary was crossed, you feel really uncomfortable, and you still want to treat them, but it's like it's not so blatant that it's like, okay, leave now. You said these things. I can't just I can kick you out because you said XYZ. Sometimes there's just like this level where they're just crossing the line, and you're like, okay, what's going on here? I feel, I sense that you're being inappropriate, but you're giving me like justification to be like, get out. So that can be a very challenging type of patient to deal with and pretty uncomfortable. So my suggestion is to, when you, all of the things that I've talked about already, setting up a clear, concise, step by step of what you're going to do, and you making the room the way you want and you having everything organized, that is going to keep a lot of this from happening in the first place by having this organization set up. And when people go further than that and they do start being inappropriate, you have to just have the confidence to be like, okay, this is not what this is about here, and I'm just going to have to leave the room and ask you to leave. And of course, if you're in the clinic setting here, you go and tell the front desk what's up, you go tell your supervisor what's up, and that's that. Um, this has happened, I think, a few times with some of my when I was in clinic here, people just made some of the, not me personally, I haven't experienced this, but some of the practitioners feel very uncomfortable. And you can ask to not see a person again if it comes to that. But if it's a common occurrence, you don't want to have that person just continuing. So if it's something that's male or female, maybe they only can see male clients or female clients. It's really important to have a boundary and not just be like, oh, it's okay, I'm just going to brush it off. Like, no, that is not, it's not okay. And I think people sometimes take it onto themselves like, oh, I must have done something to make this person do this, or oh, I must have said something or allowed this behavior to happen. No, these types of people, they have an agenda, they come in and that's how they want to act, and it has nothing to do with like us per se. So having a very hard boundary. You can straight up tell them like, hey, that's inappropriate. Don't talk to me like that. Like I have no problem saying, please stop. Or um when I've been a massage therapist for many, many years. I don't even know how long now. Almost 20 years. And people always ask me if I've had like weird interactions like that. And I honestly have had in 20 years less than 5 times where people have done that. But it's because I go into that room and I have a confidence about me. I'm like, this is what we're doing. What's your problem? Where do you need to work on? Okay, what I'm going to do is do this, this, and this. I'm going to have you go on the table like this. It does not allow room for any questions about what's going to happen during that treatment. So I think that has helped me to not have those experiences. But there are people out there that are always wanting to push the boundary and just be a little bit, different in what they're doing and saying. And, you know, we just tell them politely, hey, this is not appropriate here. And I'm going to ask you if I have to ask you again, you are going to leave. The end. Yeah. So be confident that you have the power to do that and don't let anybody push you around. Let's see. Okay. So we're gonna go through the next two steps on this, and then we're gonna take a little um break, probably around 10, and then we're gonna go through draping techniques. Just to help patients feel more comfortable when they're on your table. So after we've done all that, we've had them on the table, we have needles in, etc. What are you going to do during your session? So first you dim the lights, check their comfort level one more time. And after we leave, I do think for some patients it's important to check in, especially if it's their first time getting acupuncture or they feel a little anxious. You can tell they're a little nervous. You can ask them straight up from the beginning if they would like to rest the whole time and you come back in 15-20 minutes, or do you if they prefer that you check in on them. Just giving them the option is really nice because some people don't just want to be left alone for 15 minutes because it's stressful. Regardless, I think on new patients it's good to check back in after 10 minutes. And during this time, what are you doing to help the whole flow of this treatment session go smoothly? So obviously, if they need herbs, you're getting the herbs ready. Um, and if you're stumped about something, or if there's just something that, this patient presented that you weren't so sure about, this is a good time to do a little bit of quick research or ask your supervisor questions about like what's really going on here, or um, do a little bit deeper dive, because sometimes when we're trying to come up with a diagnosis and points really fast, we don't have a chance to really process and think about what's going on. And um, the next thing I would do is prepare for what may need to happen after their appointment. So if you are thinking they need herbs, you need to have clear instructions for them, either written down or verbally tell them and then have it written on the herbs for how they're going to take the herbs. Or let's say if you want to educate them on lifestyle choices, just telling a person is one thing. Some people like it, they hear it, it goes in their brain and they do it every day. Other people, they need like it written down. Some people need consistent reminders. So, I think it's nice to ask them like, "Oh, hey, I'm just going to write down these suggestions for you." Another thing we can do in the clinic here is follow up. Like in a few days, you can be like, "Hey, just reminding you, this is what we talked about. I just wanted to send an email to make sure you had all this information. Let me know if you have any questions." So that's also really nice to do. Um, and other things like if you're rushing, like if you have a patient 15, 30 minutes, you need to prioritize what you're doing to just have everything in order. Um, Setting up your next room, making sure you get those things written down and the herbs ordered just so you can prepare for your next patient. Like I had mentioned just briefly in that past slide, I really think a, something that's lacking in our um, care for our patients and our treatments is working in time to consult with them on their lifestyle. We all know acupuncture points can change the body and have a profound impact on the brain, the nervous system, everything. Um, but something else is like patient education. Like that goes a longer way sometimes than just the needles. Helping them figure out what in their life is causing them to have the problem they're coming in to see you about. So I know an hour is a really short amount of time, but that's where like that I don't know if we do you know if we still have those
I don't think
templates?
So I was just gonna ask, do you mean the template?
Yeah,
like
remember those?
The patient care.
We used to have a patient care form that said herbs, educate like exercises, diet, lifestyle. So maybe just have your own notebook and just if for each of your patients, just write down a few things handwritten. It just really feels like when you get a handwritten little note from somebody, it just is like, wow, they really care. They took time to write this down. You know, things you can write about, as I've written here, they're herbs. Give thorough directions. If you want, you can even be like, these are for this to help you feel this. Because sometimes when there's like that mind body connection with taking herbs, um, they work better. It's like almost a placebo effect. These pills are going to make you have energy. Oh, maybe they do, maybe they don't, but I think just getting the brain on board with what you're doing will help. Supplements, if you're recommending any vitamins, minerals, other things, make sure you write that down and how to take them. Referrals, if you suggested they see a chiropractor, it's important to chart that in your own soap notes. Write down the name of the referral and the phone number if you know it, and then also give that to your patient. And detailed instructions, you know, three scoops, 3 times a day before meals. If you don't have to write this down, but explain to them why. So maybe it ingrains in them better. Like, why do I have to take this before a meal? Oh, because this is a tonic and we like to have those in our stomachs before meals because it starts doing its job. And then you add food and it just helps transform it better, whatever. Um, just giving them as much information as you can and as also that they can tolerate too. Some people we can't overload them on um their first treatment because they're like, wait, what? And they just don't want to come back. This is overwhelming. So that comes back to reading the room and understanding your patient, understanding what's really going on in their life. Exercises and stretches, you know, these are great to recommend. A lot of people suffer from pain and orthopedic issues, and versing yourself and knowing at least a few suggestions, you know, some stretches for sciatica, some stretches for lower back pain, some movements and exercise they can do for neck and shoulder tightness and tension discomfort. Those types of things really go a long way. Some people know all of that already, but you telling them is there's just going to start build this trust between you and the patient even more. And that's what's going to make them want to come back to you like, wow, they know so much about every aspect of life. I want to go to them. I want them to help me. And I know this is just for a school clinic, but um, since leaving school, I've had patients want to come see me in my private practice because they are like, I just really like the care you gave me. And it just continues that way. If you try and dedicate this amount of energy towards every patient, you're going to have lifelong patients. They're really going to respect you and feel like you truly care and that you're giving them everything you can because you are. Oh, somebody's at danger, danger. It's okay. Come on back.
I'm coming back. I'm coming back because my patient.
Fun. I don't even know who's left here anymore, but it's okay. Oh, we just see these little, yeah, okay. And okay, so
Information.
oh, thanks. I, this is, yeah, I enjoy teaching about this because I've been a patient and I'm like, what else? You're just leaving me with these cupping marks and these, like, that's it? Like, what am I supposed to do? Like, just come back every week and I'll be healed? Like, obviously, that's can help some people, but that's not going to help everybody long term. So, also talking about if you're going to write down some diet and nutrition, I don't know if we still use that book, probably the Healing with Whole Foods. Did you guys use that in TCM nutrition? Yeah, that book is, I mean, I love that book. You can get, I mean, now you can just ask Google and Chat GPT, but that book gives you so many great options on what food to do for each pattern. I randomly opened it the other day and there was a pattern, we'll say, about what to give somebody who has a liver something deficiency due to not being breastfed as a child. Like it's so in depth and but when you read it, you're like that makes so much sense. Like everything, I mean, that book is really great. So giving
The blue one, right?
yes, I healing with whole foods like tan and then blue,
Oh, okay, maybe
I think. Um, who's the guy's name? Bob?
I'll know if I saw
Is it Bob? I don't remember. Yeah, book. I
Isn't it
mean,
Paul Pritchard? Paul Pritchard?
Paul Pritchard. Yeah, that book is amazing and it has so many good recommendations. If you just, we used to have these handouts in clinic, like, I don't know,
They're still there.
are the folder's still there?
They're still there,
Okay,
yeah.
if you guys haven't found it, there's a folder and it has these
Oh,
printouts.
yeah, it is.
Yeah, blue and tan. Has these printouts for eating foods for each like spleen damp or liver chi or liver heats or we have them in the clinic somewhere, but you can also go deeper.
I gave some to my patients last night.
It's a
Oh,
great,
really? So there's some still in the. It's just in the sleeve, so if you open the folder, it's in the sleeve.
it's a great resource.
I'll show you.
Did I miss something? All the paper I saw disappeared once we got.
I know a lot of paper did go away. But we were talking about if those papers for the lifestyle recommendations, do you remember those? We used to have like a form that had like different sections for herbs, supplements, referrals, diet and exercise. It was really nice.
God, you know what, we have to ask Dr. Farshi.
Yeah, they were really
those.
great. And I honestly think we should be filling one out for every patient
That's a good
because,
idea, I'm with doing that.
yeah, or just have a little notebook.
When you're doing handwriting, it was easy.
You can like handwriting to give to patients. You just like type it in what you did recommend, but you give them this paper and they're like, "Oh, thank you. Like I know what to do about my week now."
Yeah,
So,
I've known there, it has Tai Chi, so I tell them, hey, you have
yes.
Tai Chi for less in the mornings. Just come at 8 o'clock.
Yes,
Right?
giving them referrals for different types of like classes or exercise, whatever you may think will actually help them is really valuable and it's just going to make them trust you more and just it's in the long run what it does is it also helps, I really believe it helps their treatments work better because they're coming into the treatment knowing they're getting the best they can get because you really are caring and you've given them some little things. I don't like to overwhelm people, so I mean, I have in the past been like, okay, take these 3 supplements and try these herbs and drink this water with this salt and then do Pilates 2 times a week and go walking every day and you're going to feel amazing. Yeah. I mean, if I did that, I'd feel amazing too, but do I know? So just give them like one or two things. Be like, hey, this week, I think like pick what you think would be the most beneficial for the week for them to focus on and roll with that. And, lastly, be very thorough and very clear. Like, we can always giving them your email is totally fine. They encourage that. I don't think they tell us that so much, but they encourage us to like communicate with patients.
They do.
Yeah, like
I have literally never heard that. Have you?
I made phone calls through the office,
email, like your student email. You can totally just be like, hey, just following up with those herbs. How are you feeling 3 days in? That's really like, especially when you're giving a new herbal formula, just if they, and then be like, I actually feel nothing, or I've been, having diarrhea for 3 days. Like maybe it's waiting for them to come back in, or maybe that like quick email helps them to come back in rather than just being like, these didn't work. I'm not going to come back in. So um, don't feel afraid to do that. I know it's a student clinic. You're in so many other things like classes and work and life and doing clinic hours. So dedicating this much time to a patient can feel like a lot, but once you're in practice, you really want to have this like solidified for yourself, like how to go about your day with your patients, because then you're just going to be like this and you're going to feel so good and confident and really be able to be successful and have return clients and patients, because that's what we all want. Okie dokie. Lastly, when you're ending the appointment, you want to end it with the intention of seeing them again. Don't just be like, all right, peace out, have a great day. Nice seeing you. Nice poking you, the needles. You want to talk to them about booking their next appointment. If you are in private practice, you just, hey, when do you want to come in next? Easy. But when they're booking up at the front desk, just be like, okay, when you check out the front desk, these are my days I'm in. Like, or if it's a return patient already, be like, see you next week, or just a little comment about when they're coming back next. For newer patients, or if you're starting on a new type of treatment plan for a specific diagnosis or disorder or whatever ailment, explain the benefits of multiple treatments to them. Just be like, look, I hope this treatment gives you what you need today. But the benefits of having multiple treatments, treating things long term, my favorite go-to line is like, this problem didn't happen to you one day. So if it did, if it was like an injury, that's something else. But if it's like it's built over time and take a little bit of time. I usually say, 8 sessions is what I like to group mine in, like try 6 to 8 sessions. For something that's like a little bit more difficult, you can say 12 sessions, 2 times a week if you can. Once a week is amazing. Every other week is fine too. Just try to just encourage them that coming back is going to help them in the long run and actually help resolve the full issue. I mean, I have a few patients from the clinic here that came in, with shoulder pain, and we worked on it for many months because she was in her 70s and it was a long-term shoulder problem. But it took us 8 months, but she wasn't coming in every single week. But after 8 months, she was like, I'm 95%. Like there's like the healing pattern that happens naturally when you have an injury. And for, older people, it takes a lot longer, obviously. But during that process, you're supporting their body as well. Like, yes, the shoulder is going to take time to heal. Of course, the needles and stuff and Tweena, whatever, help it heal quicker. But also, like, she also had diabetes. She also had a really stressful job. So all of those things play a part in letting the shoulder heal. Like, if we can help their body be more at a homeostatic level while it's healing, then the body doesn't have to focus on doing all those other things while it's healing an injury or a shoulder. An injury or shoulder. An injury.
Shoulder injury.
A shoulder injury. So it's important that you're able to explain how acupuncture works in your own words for people to understand. Um, I think I gave just a little bit about how I do it. It's like the needle goes into your body, and your body's like, oh my gosh, foreign invader. It's like a mini stab wound. And so it's like, send help, white blood cells, red blood cells, your good like dopamine and serotonin all start flowing, whatever. Just whatever feels comfortable for you to explain, like be able to explain that. Just helps again, the mind, the body, the spirit all like be connected. We all know it is already connected, but when you're needling the body and the brain's like, what's happening? If you've already explained to them what's going on in a cool way, they don't, their brain's like, oh yeah, I'm sending good things to this needle. They already know, and it's just going to be more powerful. Yeah, offer your email for questions. I know I don't know, sometime I think this is allowed for sure in clinic. People do it, have done it all the time, but they don't tell you that to do it, but it is like, especially if someone have someone on herbs, it's good to do. And then consistency and trust is a huge thing for change for many people. So giving them the same experience each week, this is why when they go to different practitioners every week, it's important that we all kind of have the same baseline for how we're going to treat patients, which is hard because everyone has different personalities, but that's why they had me do this like presentation, just to like have an expectation, like that's a high standard for when a patient comes in and how they're interacted with and how they're treated and what they are getting from their treatment. So yeah, just to review, there's a weird picture of me. The end. Um, touching feet. So, number one, set yourself up for success. Be organized. Don't just fly into, I mean, there's days where I get to my office and it's 9 o'clock and I have 9 o'clock. It happens. But if you've like left your room neat and organized before, it's gonna like help it go smoothly. Um, make sure you have all the things you need already set up for you in your room, and make the first interaction very meaningful. Talk to them, look them in the eye, shake their hand, um, be a little over bubbly sometimes. It's just going to go a long way. When you're doing your intake, be very thorough and sincere in your questioning, of course, but like again, like we talked about, some people do not give information freely. Other people, they rant all the time. So it's really important that we're observing the body, observing what they're doing, touching their skin, touching their hands, like looking at their skin, their face, everything that we've learned. Um, checking their tongue and pulse. Like sometimes those things are going to be the only type of intake you get depending on the person. And after you have them down, or like you're on the table or you're about to have them lay on the table, explain to them step by step how to get onto the table, where to put their things, what you're going to need from them, what you're going to do, because this just will calm their nervous system so they can have a great treatment. Step 5 is be confident. Be confident that you know what you're doing. You spent so many years in school learning everything. I know it feels daunting. Like I had this imposter syndrome when I first started in my private practice. I was like, am I doing anything with these needles? Do these even work? I'm just here going about the day poking people with needles. Like what am I doing? And then, it took a few weeks for me to be like, oh yeah, the patients come back. They say they feel better. And then you're like, oh, okay, I'm doing the right thing. It works. But just be confident, and then also be confident in dealing with difficult patients. If you're having, like we talked about, people that are just being inappropriate, have a clear boundary, already outlined in a lot of the paperwork is, a lot of that, like this is, a treatment. There's, any type of sexual stuff is going to be, you know, not allowed. You're not allowed to leave. You're going to be asked to leave, etc. But be confident that if you have somebody that comes in and they're just making you feel uncomfortable, you acknowledge that. Like I have no problem saying to a person that type of conversation and that type of talk isn't appropriate and makes me feel pretty uncomfortable. So you can continue, but I won't be seeing you anymore. Like straight up. Do not allow it just because you're trying to be nice. Like it's not worth it. And don't feel like you need to keep a patient because you want to have X amount of patients or anything like that. No, more will come and you don't need to have people that make you feel like that. Step 6, optimize the time while the patient is getting their treatment and laying on the table. Make sure you get your herbs done, make sure you're organizing things. You can be looking at your next patient's chart, but I really like to try and stay focused on the current patient. And then step 7, spend time on lifestyle education. This is just like the most important thing besides getting the points right and the diagnosis right. Just giving them a little homework or a little bit of like just, hey, did you know that this might be the reason this is happening to you? Just talking with them and educating them on what they can do in the downtime in between treatments to maximize what you're doing when they are with you. And step 8, ending the appointment with the intention of seeing them again. So, like we just said, letting them know, hey, I'm available these days and I want to see you again because X, Y, and Z is the great benefit of doing this multiple times, etc. So, yeah, hope that is all. Any questions or comments, Mom? No, no. Yeah. Yeah, I just want to like I guess it's just a lot of you already like you're deep in clinic, you've been working with people forever, you've taught classes already, you've worked in situations, but there's a lot of people coming in that just like I don't know. Yeah, maybe some of those
Be a class.
It should be.
should be a class.
Like Brady, remember Dr. Brady, how he had a clinical class. We had
It was like
clinical 101.
no, it was
No,
like
it was-
clinic management.
Yeah, clinic
And
management.
mine was with Dr. Perez, and that was really a really great class. He was pretty thorough and talking that. So I think they have patient care is where they were asking if I would.
This should be like infused in that curriculum because that's where it's really, because that's when you have all the needs.
And also
Yeah.
when people are observing, they should be
Yeah.
having a little class in that too.
Yeah.
Yeah, this is like, I think a good precursor.
Yeah,
Because then by the time you're an intern,
right.
you already got it all.
Yeah.
It's like an afterthought afterwards.
I know.
Like,
By the way.
Yeah. They did ask me if I would be able to teach this late, like during another class, like intro to patient care, like have this be part. So we will see. But yeah, I'm glad you guys like the information. I think this is cool. We're gonna take a break for like 20 minutes. The draping, I'll show you some right now real quick.
My patient.
What?
Come at 10:30.
Okay, well, I'll go over with you. So we're gonna take a little break. And then we're gonna go over draping techniques. Some people were like, "What is draping?" It's covering your patient to keep them as covered as possible while accessing the points and areas you need. Some people I have been massage therapists before, Adam. And this is where I learned really great draping techniques. And it's going to just help the patient also just feel extremely comfortable on the table. And we just want to keep them as warm as possible, covered as possible, tightly like, swaddled in there so they're can actually relax. But yeah, let me see if I can stop this. I don't know. Okay, there we go. My screen is so little. I don't really understand. Okay, great. Does anyone have any questions or anything before we take a little break, or questions about what we're going to talk about in a minute?
No, I just thanks for that step by step. It's helpful to
Yeah.
have to kind of have it drawn out like that. So I agree. It's a good thing to offer
Yeah.
to people who are entering the clinic because it's more succinct than what we're learning in like clinic theater and clinic management and stuff.
Yeah, I think like I learned this over like, 15 years of working with people doing massage therapy. And so I felt very confident in doing that already. But I remember when I first got out of school, I was like, okay, what do I do? I'm like, okay, come in, lay down for your massage, the end, and the same for a lot of people. When they're first getting into clinic, they're like, what do I do besides put needles in people? So yeah. Alrighty, I'm going to pause this. Has this been recording? Probably not.
Yeah, it's recording.
All right. Okay, cool. Well, I'll see you all at 10:30. How about that? Bye. More work. Sure. Now I'm like, Alrighty. So, still waiting for my only one in-person person to come back. This portion of this class is a little awkward to do over Zoom. I think they will be offering a sign up for anyone that wants to come and learn how to do the draping in person and practice in person. The techniques that I'm going to teach today. I'm going to try and give as thorough of an overview with my words. And I think I'm going to switch to my phone camera for some of this. I don't know. We're going to figure it out. To show you what it actually looks like on a person, because yeah, it's gonna be a little hard, but might just turn my computer around, might work out. No, you're fine. I was just like waiting for my little Janice to come back. So I have some slides about draping. So I don't know that we really went over any of this too much during our master's program or anything, like, you know, during um during our needling classes, we were shown where to and how to access the points, and you practice some sort of drape, but getting like a very proper drape and something that's tight and not revealing does help. So let's see. Share screen. Alrighty. So, draping. Draping is using sheets or gowns or a person's sweatshirt, if that's all you have, to cover their body and get access to what you need to get access to. All right, so why does draping matter? Why is this even a thing? Why are we having this class? So obviously, patient modesty and privacy, and it ensures that only the areas that you need to work on are exposed, and it helps maintain a sense of dignity for the patient. I know it doesn't really we don't think about that too much. They come in, they know they're going to get needled. Some people don't wear the proper clothing that we might. Janice was just talking about this, like, why do people wear jeans to get acupuncture or very tight pants? Like, people are just going about their day and trying to squeeze in an appointment sometimes. So it happens. Like, obviously, it'd be great if they all wore shorts and tank tops. That would give us great access to a lot of things, but that is not the case. So, warmth and comfort. So, obviously, during acupuncture, you're laying still for a long time, and draping can help keep the body warm. Because with needles, you can't just put a whole blanket on top typically. And I don't even know if we use those Mylar sheets anymore. Jana says no. So, yeah. Yeah, I haven't either. So this is a great way to cover up some of the body if you don't have like 4 heat lamps that you can place everywhere. This also helps, with being able to place the needles properly. A lot of times, we don't needle a lot of I've done it a few times in clinic where I've needled stomach 30, there's 31, 32, like these upper thigh points, like a GB29, lower abdomen points, different areas. When you have the sheets strategically placed, or like vice versa on the glutes, UB54, or if the bi allows, how am I supposed to needle those and not have the whole gluteus maximus area exposed? Like, this is why draping is important. So it will strategically help you to be able to place the needles and cover the things that need to be covered. So It also helps the patient be able to relax. If they're comfortable and securely draped, they're more likely to feel relaxed, which can enhance the effectiveness of your treatment by reducing muscle tension and calming the nervous system. It's a little tiny thing, like to drape someone properly, but if they're draped properly, it can help their body relax, which in turn is helping your treatment be more powerful. Like it's a cascading effect of things. Also for hygiene and just professionalism, using clean linens and proper draping, helps us keep things nice and neat and looking very professional and like we know what we're doing, which is what we want to do. All right. Some of the things that you might need in your room to be able to drape a person properly. Flat sheets. I know now they have table warmers on all of the tables. You know who started that one? I would bring my table heater every day from home and put it on my table here at school because I just felt so bad because it was freezing during winter in some of those rooms. So that was funny. But yeah, it's amazing just how just a little warmth. So we need flat sheets, which you do have one on the bottom of your table. I don't know how many you have access to throughout the day. A flat sheet is great to drape with, but I'm going to show you how to use gowns mostly because that's what we do have access to in the student clinic. Um, Towels are great as well. Pillows, pillowcases, bolsters, tissues, or if you do like a little eye mask and you have your own, you want to put a tissue down first so you're not putting an eye mask directly on their face, contaminating things. Pillowcases make for a great chest drape if you need that. Towels can help in that area as well. Towels can help secure a gown as well to keep it covered. Bolsters are, let's say you need to do a side lying GB 30. You want to prop their legs up properly and then have them draped comfortably so they can lay there with a large needle in their glute for a long period of time. Okay, so what we're going to go into is the different draping areas. So the most common for a back treatment is the full back draping. When we're doing this, the key is we do not, when you have the patient prone, and you're trying to do like any points on the lower back or the glutes, you do not want to expose their gluteal fold, aka butt crack. You just don't. It does not feel good to anyone. Some people are comfortable with it, of course, but the majority of people do not like the feeling of having that exposed. It just it doesn't feel secure. I feel like the sheet can move any moment and your whole backside could be out. So we want to try to avoid that. So when we're doing a back drape, you're going to slowly you can put your hand on their sacrum so they know what area you are going to be draping to. You're not going to drape them below their top of their crack gluteal fold. You're not going to bring the sheet below that. And by putting your hand on their sacrum, it just is like, and telling them then, I'm going to undrape your back now. That's all you have to do. I'm going to undrape your back now. And then you fold the sheet from the top down to a little bit above that area. And what you're going to do, I will demonstrate all this to the best I can over Zoom. I mean, Janice is just going to be a draping pro. So if you need to ask anyone in the clinic what to do, this lady is going to know. You're going to reach across under their hip and you're going to tuck it in underneath their hip on each side. You can almost lift up their body and tuck it in a little bit, and then you go to the other side, lift up and tuck. You want it to feel tight, you want it to feel secure. If you've draped it too high, like let's say you're this far above the, top there, and you can fold it down to the area, but you just want it to feel tight and secure. If you are going to be using oil and they have pants on or underwear, etc., you can take the top sheet or a gown and you can tuck it into those things. You don't want to go like so far down into it, but you can do a little tuck to cover that fabric so you're not getting oil all over their clothing. This is just for the back. We will definitely go into, if you need lower, we're going to discuss how to do that, but this is just for like a full back. And the thing with the bottom portion of this, you want to keep them as covered as you can on their legs. I understand we'll probably be putting some leg points in as well. So the whole idea is just to keep them as covered as possible the whole time. And let's see. And just always tell the patient what you're going to do first. Like that is just really important. Just or ask them like, I'm going to undrape your back. Is that okay? Yeah. I anticipated you doing that because you're going to cup my back. But still, just asking is always good.
Can I add something, Sophia?
Ah.
This is Adam. I'm also been a massage therapist for many years, and one of the things, just to reinforce what Sophia was saying, is that tucking the drape under the hips or securing it in some way so that the fabric is pressed against the skin is key, because even if it's just like 2 centimeters off the skin and it looks like they're completely covered, what it feels like to them is that there's a whole area that's not covered. It may
Air
look
is
it may look covered to your eyes as the practitioner. To them, it feels like their whole butt is, there's air on their butt, and so it may feel to them like they're not covered. So having it tucked and the fabric pressed against the skin helps to make them feel like they're secure and covered.
1000%. I think that's like I'm always talking about tight, tight, tight draping, like making it tight. You want them to feel like nothing is going to move, nothing can go in there, and that they're very secure. Like it's like a piece of clothing. It's on them and it's tight. So yeah. Thanks, Adam, for that. Yeah, this picture over here, I was just looking for pictures. This is something that could happen if they put their gown on, face, like let's say they have their gown on and it's opening to the back. This could be an option. You would have them like it would come off of their shoulders a little bit. Ideally, what I would do as well is I would take another towel and put it across this area and tuck that in just so their butt is secure and covered and doesn't feel like anything is moving in that area. Okay, glute draping. So this little thing that I created over here looks a little crazy, but I will explain it. And when I show it in person, like showing how it works, it will make a lot more sense. So how I do a glute drape that gets a very pretty covered, keeping everything as covered as possible. If let's say you're only gonna do points on the glutes, like here, like a GB30, a UB54. This one would be for more this side area of the glute or any lower back stuff. And these can be done on both sides. I will show you how, but the gray areas are where I've covered with a sheet as well, just because I'm not using that part of the body, so I'm just going to keep as much covered as I can. So it's so hard to just explain this over Zoom, but I'm going to do my best. I would love to show you in person if you have time and can sign up and do that. So what you're going to do, first you will do a full back drape like you did. You're going to fold the sheet down to here. Then you're going to take this portion of the sheet that is covering their glute, and you're going to first put your hand right here on the top so they know that you're not going to expose that area. You're going to fold it back to 45 degrees. So you're going to, this is where the sheet is. You're going to fold this back to 45 degrees. You can tuck it under the ear and you're keeping your hand here. Then since you folded the top portion of this sheet down, you have all this extra fabric here. And what you're going to do is you're going to pull that fabric up and cover the other side of their back with that extra fabric. It might not go all the way up to their shoulder, depending how large your sheet is. If you have a gown, it'll go maybe to their waist. But you're giving them a little more security, and you can tuck that even under this side if they are, without anything on top. It will feel more comfortable. So this is a little bit hard to explain how to do via Zoom, but I'm gonna try to do my best to show you how to do it. That's that. Any questions on this? Does it make any sense what I said? Like, folding back this way, tuck here, and tuck here. Once I talk about how to drape the posterior leg, which is coming up, we're going to go into how, let's say you need to needle bilateral bilows. How are we going to do that? It's going to involve a combo of this drape and a posterior leg drape. So this is the posterior leg drape. This is what it can look like if you need it to be. And then you can also fold these corners in to get the whole glutes. All right, so describing this, you can hold the sheet at the patient's hip here. Pretend like this, they're covered. You would hold the sheet at the patient's hip here. Oh, hey, how are you? Oh, good, you came at a good timing so we can go over the draping. Yeah. So you can hold the sheet here, and then you're going to pull this sheet up to, let's say you need to get up here. It depends what point you're trying to get. If you need like GB31, if you need higher, fine. If you're trying to do some leg points, like, UB, I feel like this is 36. Don't judge me if I'm wrong. No. Yeah, 36 is under the butt cheek, I believe. You need those points, this is how far you're going to go up. If you only need UB40, you're not going to have to drape all the way up to the glutes. So you're going to hold here, you're going to pull this sheet up, and you're going to make it a diagonal, like the glute. You're going to make a diagonal here with this like edge of the sheet. So you have a lot of fabric to work with. So put the diagonal here. You're then going to lift the person's leg by putting your hand from this inside under their knee to support the knee, because you don't want to just lift from the ankle, hyperextends the knee, it feels weird, or their knee just bends. So you want to support the knee, and you can use your whole forearm if you reach around in here and lift under the knee with your arm under their leg. And you're going to lift up and you're going to quickly tuck the sheet and pull it tight. Now, this is where I feel like a lot of people don't do the tight draping. They might just tuck it. Like I've seen a lot of massage therapists, etc., just unfold this sheet up here and tuck it underneath the opposite leg, or not wrap it around so they're not covered. Like this one doesn't look like it's wrapped and tucked. Just ignore that. I was just showing you what I'm talking about. The drape has to be wrapped around the leg, so some of the sheet is coming out of this side and that it is open, so you have almost like a diagonal here, and you can pull each edge of these so tight that it feels like they're in a diaper. You can repeat this on both sides, so it does create a diaper if you undo the whole back. Again, these are all best shown in person. This is just the best description of I can do. So next, anterior leg, same idea. With the anterior leg though, instead of just having like glutes to worry about, you have the whole genitalia and groin area to worry about. So this is very important to make sure that this tuck under the leg here and the top portion are very tight. You don't want anything to feel loose, anything to feel like it is gonna fall out, anything to feel like air can fly up in there, because if you're needing to needle these higher points that are like close to the, even you can go up as high as the ASIS, the inferior portion of that you can get on the side of the leg here. You can get these upper stomach points. You can even fold this over enough to get some of these like inner area. I wouldn't say as far as stomach 30, but maybe if you need to. We don't tend to needle these in clinic, but there might come a time that you do. Again, it's tucked very tightly. You have the sheet on their upper body covered. If you only are doing one leg, just undrape one leg. If you're doing both, you're going to have to undrape both of these legs. And again, it looks, when you wrap it around the leg tight, it ends up looking like a diaper. And you can use another towel over this section here. Let's say you do have to undrape their abdomen. Having another towel here as just like a pressure over that area, like Adam was talking about too, like you want that pressure of fabric on your skin can make them feel even more secure rather than just a gown or a sheet. Chest and arm draping. So this is important to talk about because do not assume just because a person does not have breasts that they wish to have their nipples exposed, like for, let's say, male patients. A lot of times we'll just undrape the abdomen and just start needling away, like full chest and everything is out. There's like two parts to this. One, they might feel uncomfortable. Two, if you can keep them covered as much as possible and keep them warmer, it's better to just keep them warmer. So if you're not needing to needle that area, cover them with a pillowcase up here. And then you'll have the whole abdomen out and you can still have as much access up here. Treat everyone kind of the same in this regard and you will not have any problems. Now, if it's like you're doing acupuncture and your air conditioning breaks and the guy's like, I don't need that top thing, okay, but it's best to keep everyone covered because it gets cold. And most of the time we know our body relaxes and we cool off when we're getting acupuncture. So a lot of times patients will be like laying their both hands underneath a sheet or a gown, maybe not if they if you've asked them to get undressed from their waist up, they most likely are just covered. They may or may not have a bra on. So if their arms are under the sheet, what you're going to do is you're going to tell them, you're going to tap their arm and be like, hey, I'm going to move this arm. You're going to take it, you're going to hold the sheet, you're going to pull it out to the side first. So you can grab their hand and pull it out to the side. And then you're going to be holding this corner here. You're going to lift their arm up and you're going to tuck it under and you're going to put their armpit. You're going to tuck it right up into their armpit very tightly. So it is tight right into here. Now, let's say you want to do heart 1. What you can do, you can lift the arm up and you can tuck it back underneath their back here, like this picture is showing more, like almost making it like a shirt, tucking it on the side. Some women have larger breasts, so you have to be mindful of that. Just be very open and talk about what you're doing with your patient. Just be like, hey, I'm going to tuck this under your side here. Sometimes you can have them, Janice was saying we were practicing some before we came on here, you can have them roll a little bit and then tuck it and then have them roll back. If you need to get into their armpit or these like side points here. Let's say you want to do spleen 21 and you need access to that and it's not going to feel as tight. Like I will say what you can do is use a larger towel. You can tuck up above their shoulder and under the waist. So to keep, if it's a male patient or someone without breasts, it's much easier. You can just have the sheet kind of over, but if it's someone with breasts, you want to make sure that you are keeping them contained. Tuck the sheet above the shoulder and on the side here. to do these side points. When you're doing abdomen, if they are like you just want to do this drape as well when you're doing the abdomen. Like these kind of just go together. So this draping, you can see there's a towel up here. This, I would assume that this arm is down and tight over this towel. If not, we'd want to tuck this towel underneath the body. I'm sure this is just an image to show hands on an abdomen, not draping techniques. But this is a pretty decent drape for the lower abdomen. You can see they've tucked it into any undergarments or pants that they have on. That is totally acceptable. Most people will have their undergarments on in an acupuncture session. And you can do a slight tuck, like about 1/2 inch to 1 inch in there, and then tuck it very tightly underneath each side of the hip. There does come a point where let's say you only need this section and you aren't needing any of the legs. You know how I talked about the glute draping? You can do something similar here. Just imagine it's just reverse. Like if you need to get any of the access to this area, like the psoas, lower attachments or anything, you can put your hand like here, it would be above the pubic symphysis or a little bit off center. You will unfold this corner and you will tuck it under their hip here. And then you can even take, if there's a portion of this towel, and cover up the other side of their body if you want to work on that. Just so there's, again, we want everything to feel secure. We want it to be tucked somewhere so it is not going to move, and nothing like a big breeze of wind is not going to come in and make it fly around. And when you're doing an abdominal draping, you put the chest drape on first, and then you will slowly pull down the sheet while holding the top of the drape for the chest until it clears the chest drape. And then you can fold down and tuck into the hips and secure the chest drape. Side lying draping is a little bit more challenging. It's not as clear cut because it depends on what you're trying to access. Sometimes we have pregnant women lay on their side, and that which requires a lot more bolstering and to make them comfortable, which I feel like we don't really learn. Did you guys learn anything? Yeah, learn how to make a person comfortable laying on their side. I'll show you some stuff with some bolsters here. Again, just follow the same kind of path that we want to tell them what we're doing. Put our hands where we're not, like you're not going to pass this line, draped there and tuck. So for the leg, oops, I don't know what that is. Weird. Okay. What is this? A timer? Okay. Oh, wait. Okay. For a side lying leg drape, let's say for us, most of the time, that would be a GB30. There's many ways that this could happen. It would depend if a person has underwear on or not. And I recommend having you can do it with one gown totally or one sheet, but depending on what they're wearing, it might require an extra to make them more comfortable. When you're draping for the side, a lot of times what you can do is first have somebody lay face up. If they're not a pregnant patient, you would have them lay face up. If you're just going to try and get GB30, you face up, you do the anterior leg drape, like you would do wrapping and tucking, and you could pull it up further, like this is coming from wrapped around. and then have them turn onto their side while holding it with the back portion of the sheet right here. This, and then you would tuck everything underneath the opposite side of their body that is still touching the table, and you'll have really great access to the whole side of their glute and leg. Again, sometimes to secure that, I would just put another towel over top, tuck it in just to make sure nothing is moving. It's a little complicated to explain like all of these, but we'll show you later. Yeah. Okay. This is a random one I threw in here because I thought it might be important. So if somebody is laying face down, this is not, do not do whatever this lady has here. This is just a picture of me. Yeah, showing what I'm talking about. Okay. Pillowcases are or a towel. If someone's laying face down, head in the cradle, you're going to take this pillowcase, you're going to pull all their hair towards you to come over the edge of the face cradle. You're going to put this sheet over top of their head, and you're going to start turning in this and tucking it into around their head and into the hole of the face cradle. You only need to do it up to like here, just to secure the nape of the neck and here and get all that hair just secured like that. It's great if you need to cupping, if you want to do running cupping on the traps. This is just a great way to make sure all the hair is covered and out of the way. You're not getting oil on it. You're not going to light it on fire, the end. If you don't have access to a towel or anything, of course, you can put if they have long hair, you can pull it all up, twist it tight into a bun. For people that never had hair, this might sound complicated. You can twist the hair and you'll tuck the end into the face cradle. I will try to show this as best as I can later. Okay, and just random comments. I have, as we talked about in the first part of the class, confidence in your movements and what you're doing. If you're doing everything like very light and you're doing it like soft, it's not gonna feel so secure. You're gonna put your hand down, you're gonna take the drape, you're gonna unfold, you're gonna crease it like nicely, you're gonna wrap and you're gonna tuck tightly so they feel like this is secure. If you're just like gently like folding it and like this type of movement on the skin does not feel, it feels cringy to most people. It just feels like, ooh, it tickles, it doesn't feel good. A firm hand anywhere feels a lot more like a confident movement when you're doing anything. Again, always explain what you're doing and gain consent, especially if you're working on the glutes or any area around the groin or the chest, those sensitive areas. When to be like, okay, this point is this, whatever. I'm using this point to treat this for you. That is why it's a really great point to treat blah. It is located in this area. Are you okay with me undraping you to use this point? I really think it's beneficial in your treatment. Like telling somebody that rather than be like, hey, can I just undrape your butt cheek? Do you mind? Like if you give them a very nice explanation of why and what you're doing, they're gonna be like, oh, okay, yeah, sure. I feel it's like just a better way to explain something to them. The tighter, the better. I can't reiterate this enough. Tight draping is the best draping and really important. You're going to want to keep them as covered as possible. Nobody wants to be cold laying on the table. If you're not using an area, just try and cover it up or get a heat lamp on it, obviously. This happens in the clinic because we do run out of gowns and random things. Pillowcases are great. You can use pillowcases, but we run out of those too. Let's say, you want to access somebody's chest, upper kidney points, and you want abdomen points, and they have a t-shirt like mine on. What you can ask them to do, man or woman, doesn't matter. What you're going to do is you're going to have them remove their shirt and you're going to leave the room. You have them remove their shirt and cover their upper body with it, their chest. You can have them just use that as a drape if you are randomly out of all the things, which does happen. Ideally, it's, not professional, but we are in a student clinic and they understand. So, it's better than nothing. It's better than having, somebody not covered. If they have like a sweater or a sweatshirt they brought with, you can utilize that as well too. Yeah.
So yesterday, I actually had a patient who like didn't have a bra and doing a needle right
Yeah.
breast, and she was like, I'm super comfortable with
Right.
this. And she just like ripped her t-shirt off, and I was like trying to give her like a pillowcase to drape, and she was like, honestly, I'm having hot flashes anyway, and so she was just like, she would rather just sit on there completely bare chested, and so I was just like, okay, we're just gonna work with it. But like, she's also facing the door too, so like I have to be like super careful, like slipping in and out, and I didn't necessarily want to be like, well, you have to cover up, like, so I don't know, thoughts on that?
Okay, so this is one thing that me and Janice were talking about that I completely forgot to address in the first half of the class, which was like how patient interaction. But yes, so glad you brought this up. Okay, so when you have people that want to undress before you leave or just want to be naked, you just be like, you have to set a boundary. Like, no matter how hard they fight you, it's really awkward. Just be like, actually, just for the comfort of everyone, including myself, I would prefer if we have your chest covered. Straight up, just be like, I'm uncomfortable. Like, this is how we drape everyone. This is how I drape everyone. And I'm sorry, but everyone has to be draped covering breasts and genital areas. Like, it's weird in the moment when they're like, I just want to be free because I'm hot. But you have to practicing some like confident sentences over and over again so you can be like, actually, this is just how I drape everyone, so if you could please, we could use this, just a thin cover at least, thank you. If they get dressed before you leave, just be like, oh, sorry, just let me step out, and just leave. And be like, knock and be like, are you covered? There's a lot of patients that just like don't care. We live in LA. People are just naked everywhere. Just kidding, but really not. So just knock and be like, hi, are you covered up? All set? Like saying that instead of being like, oh, can I come in? Or whatever, just be like, are you covered? Are you secure? Are you whatever? Um, I think it all starts from like the very beginning conversation. Just be like, okay, so I am gonna have you undressed from the waist up. We are going to cover your chest. And if they're like, oh no, I'm fine with that, like, oh no, we actually just do that for everyone. Yep, we're just gonna keep you covered. And just the chest, even if you're really hot, we can turn the table heater off and I won't use any heat lamps, but we will keep your chest covered. Like stuff like that, just to be like, try and set it up. Be like, I can fan you. Just kidding. Like if you want to like try to, if they're being tough, like kind of bringing a little humor or just, it's hard navigating those types of, I used to have when I was a massage therapist. I still am, but this was a long time ago. I don't know, maybe like 15 years ago. I had a client at a chiropractor I worked at every single week. This man, he would, no matter how many times I told him, get undressed, lay under the sheets, cover yourself. I will be back. Knock, knock, knock. Open the door. Uncovered. Yes. You close the door.
5 gowns.
You just be like, I'm not going to come into this room. You say, knock, knock. Are you covered? I will not be entering this room unless you're fully covered. Straight up. You put that hard boundary. People love to put, people that have that little, it's a little something sometimes. Maybe it's innocent. I don't know. Most likely not. With patients that repeatedly are nude in front of you. Not okay. You say, I'm not coming in unless you're covered. When you leave, you'd be like, I won't come back unless you are covered. I'm going to knock and ask if you are covered. Like, really, they like to take advantage because they're getting away with it every time. This guy, I would just go in and cover him up, but eventually I got sick of it and I told him, I'm not going to come in the room unless you're actually under the sheet this time. I won't give you a massage. Okay. So what he decided to do then, when he would roll over He would take the whole sheet and throw it off.
Yeah, that's just creepy.
It is creepy. People love to, some people have their things and they will push boundaries as far as they can push them. But because I have confidence in my, I know what I'm doing, and I'm not going to let somebody make me feel uncomfortable when I'm doing everything correctly to try and help them feel better and fix their problems. I was like, I would hold the sheet so tightly. When I'd be like, okay, it's time to flip. I would hold it with against pin it against the side. This is another technique I'll show you how to have people flip over under a sheet or gown. You pin it against the side of the table with your hip. You hold the other side very tightly so it's tight. You can lift it up a little, but they will flip and the sheet will not move because you have pinned it. So I started doing that. So there was no way this guy was gonna. What's sad is, like, his wife was also my um client at the time, and I tried to find a solution before I was like, I'm not going to see you anymore. And that solution worked. And it's unfortunate that we have to do that sometimes, but it's up to us to set a very clear boundary and be professional and try our best to nip that before it happens. Yes. So with, just practice like what you might say in that situation. Being prepared is better, like is like the best thing. So you're not thrown off. So going through these scenarios that could happen in your head, it's not like anxiety or craziness. It's like I'm preparing myself so I can confidently handle any situation that is thrown my way. Just think about, okay, I know I have this tough patient today. What am I gonna do? Maybe you need to write it down, be like, okay, I'm gonna say, be covered when I come back, or I won't come in. Maybe don't add the or I won't come in. Be like, I expect you to be covered this time when I come back. Thank you. And say it really nicely. Or just be like, cover up or whatever, just really try to make an emphasis that you expect that of them. Give them a chance to meet the expectation that you've set. And if they repeatedly do not, you have to just say, I will not be able to treat you anymore if this behavior continues because it's not appropriate. And I expect you to be covered. With the woman with the hot flashes, it seems a little bit of a different situation. You just have to say, for my comfort as well, would you mind covering up? Because it's not just, and there's, like you said, there's people walking by. You don't need to bring that up to her, but just say, this is what we do. For mine and yours, just could you please? For our patient practitioner relationship, if you would be covered, it would be more helpful to me. Like something like that.
Can I add something in here, Sophia, or really just reinforce again what you've been saying? But I know for being a male acupuncturist and massage therapist, I don't run into this probably as often as you had, but I have had it in my experience too. And the thing that like has come to me over and over the years is that if you, like you said, if you're confident and you establish, we love to say boundaries.
Yeah.
It's like a hip, overused word, but like if you are firm with them from the beginning, especially if you're one of those people that tends to be more, wanting to give too much and wanting to accommodate too much, you can create the situation where the people that want to push those boundaries will keep going farther and farther. So it's your responsibility as the therapist to be really clear and really firm, especially with those people. Some people just really need a little support in the moment or something, and that's okay. But like there are specific personality types that want to push those boundaries, and as soon as you give a little bit, they do more, and you give a little bit, and then they'll push it farther. So, and then we get into a situation where we think it's all that person's fault that they're taking it that far, but really, it's on us to be really clear about where your lines are. So anyways, just wanted to reinforce that.
1000%. It's like when we were talking the beginning of the class, it's like setting, like if you're giving, like we said, boundaries, it's awkward, our favorite new word, but step by step, what you're going to do. Like, okay, so I'm going to have you undress from your waist down. You can, in a massage, it's different, but most times if you need them to take off their undergarments, that's one thing you will tell them. If if you're comfortable with it, could you remove your underwear? Thank you. These are the gowns and the sheets I've given you to cover up with. You can cover yourself from your waist to your knees. That since if you have a shirt on top, I'll just need you to cover from your waist to your knees. If you need more than that, you just instruct them like ahead of time, like, can you use this gown to please cover from your upper chest to your knee? It should reach about there. I'll be back and we'll get you something else to keep you warmer. Like the step-by-step instructions. So there's no room for like, I didn't tell you to just take off your clothes, get on the table. I gave you like a very clear description of how I want this to go. So that helps. Yeah, and then if you enter the room and they're not covered, you step out and you say, could you please cover yourself? Sometimes I've had elderly patients, they're like, I can't reach. I will go in and cover them. They're not, you can read the room if they're trying to be intentional in what they're doing most of the time. Okay. Thank you. Yeah. No, we're gonna go back. We're gonna go back and start going over these. I am gonna do my best to turn this computer around and show you. And we're gonna take a quick 5-minute little break. I'm just gonna get some things set up and see what I can do. So take 5 minutes and we'll be right back. Alrighty, we got a cool setup. This actually works-ish. Look at your lovely volunteers. Hello, hello. So nice of them to be here. Okay. Let's start. Ooh, yeah, I'm not gonna share the screen, but I'm just gonna go through all the ones that we already just discussed. Okay, we're gonna start with the full back draping if someone is laying prone, face down. So come on up here, lay face down as best you can. So typically what we will do is we will put a bolster under their ankles. So nice. All right. A lot of times in the student clinic, you guys only have these gowns. Understandable. When I am trying to do, let's say, cupping, or I want to do a back treatment, I will hold the gown so the straight part, the bottom part, is at the top that I'm going to be tucking in. So let's say I left the room. I would hope that this is what the patient would look like when I came back, that they covered themselves with a gown, like a blanket. They most likely will have their pants pulled up or no pants, because a lot of times when we're doing back treatments, we want the lower legs as well. You might want UB4, you might want some of these like UB36, I think, up in there, the side. So a lot of times they will not have anything besides a bra and underwear, or just underwear on. So we want them to be covered. Then what we're going to do, if we're going to drape the back, we're going to take it. First, we'll just be like, okay, I'm going to drape your back. Is that all right? You put your hand on their sacrum so they just know you're not going to go below there. You don't have to tell them that. It's just a nice, like, is it okay if I drape your back? Okay. You'll take the sheet from up here, fold it down to above the sacrum area, like right up on the top of the sacrum. The way to tuck it in that works best, can move their arm out a little bit from the side. You can reach across, pull their hip up a little, and tuck it in. I'm going to do it on this side so you can see better. You're going to pull it tight, reach your hand up, under, and tuck it in like that. See how tight this is? It looks like it's a skirt she bought from Fashion Nova. It's very tight. It's not going anywhere. It's not leaving. Now, we'll get it's showing like 8. We'll get to how to drape the legs if you also, when you have like, let's say this extra fabric here, if you need like up to the knee, you will tuck it underneath the leg that is closest to you. You'll take this one and tuck it underneath the leg that is closest to you. So it's like a little, this is a modified version of like a diaper drape. So you can also roll this up then, as long as it's secure here. You can access this gives you a lot of space to do what you need to do, and they feel secure and tight. Let's say, so when I'm just doing a back drape, I like to put this part at the top, but if I am doing the legs as well, it almost works better this way, if you want to get like a full leg drape. So we're going to do the posterior leg. Let's say we only need the posterior legs. We're not doing any on the back at this moment. You're going to take this portion of the gown here, going to make a nice diagonal on the leg. What you do, you mark where you need to go up to. If you only need to go to the inner thigh, like here, you don't have to do it that bad. But if you want to get like up higher, you make it a diagonal where you need to go. Then the best way to have like a confident swooping movement to pull the sheet tight, you're going to take your arm, go on the inside of their leg, lift their knee, like under the kneecap, so you can lift their leg without it bending. Like if you just do here, it's going to be weird. You don't want to go up higher and grab their leg above the knee. It's not comfortable. So grabbing the kneecap so the leg isn't bending, you lift the leg, you have full, access of the leg. You reach under, grab this corner, pull it tight. This is how tight you want it to be, like cutting off circulation if I wanted to. Like this is not going anywhere. What we then have is free range of access with this whole upper part here. I can roll this over. I can tuck this under here. I have huge access to the whole glute, the side here. This is like the doesn't end here, you know, it goes like the whole thing up into the hip. So we have a full range here. You can repeat this on the other side as well. So let's say you want to then do, let's say you need the legs and you need the glutes. You're gonna do bilateral 31 through 34, what that would look like. You again will take your sheet, make a diagonal with the outside edge, the leg at the knee, like so it's not bending. Take this, wrap it around very tight. So now we have a diaper. And this is extremely like tight and secure, and nothing feels like there's air coming up. There's nothing happening in there. And then we have access to do what we need. If we can roll this open, if you need to do the legs the whole way, you have the ability to do that. And you can still, this is like the least covering draping you will ever do. But sometimes it's necessary. Sometimes you need all these points for whatever reason, but you would be trying, nothing is coming up through the center area into the, you know, down below. And the whole gluteal fold is covered as best as we can.
Can I ask a question? This is where I've ran into trouble, which is if I'm like doing some sciatica treatment or something, and then so I'm draping like this, but then I want to get to the baliaus.
Yeah, this is what I'm talking about.
How would
fold into the middle,
And then go on either side.
you're saying that you're actually trying to get the sheet in between the needles? Because like for someone's sacrum, sometimes it's pretty close together, those needles, you know?
It depends. So what, like, let's say you do one side first. You do that side, and then I would come and try and do the other side. Because, you know, we can put a little bit of pressure on the needles with the sheet, but I've done this a bunch, and this tends to be a really good way. With a gown, it's great. Like, you can get it pretty rolled and skinny. Like, do you feel I could get your bilaus? Like, does this look like it's, if you get
that is around.
Yeah, because even if it's a little bit, like it's
and
not
you
that-
can, like, when you have it, you can move, do one side at a time, and then pull the sheet over and do the other side.
Okay, cool.
This is just, this is like an alternative, because otherwise we're like having their whole glutes out and their whole butt cheek out. I mean, you could have like a thin strip of paper to cover, but this allows like this to be secure, and you can kind of twist it up pretty tight to cover the middle. Then again, let's say you don't do these or these, you can take another towel or something, sheet, pillowcase, cover like down here. Just so, again, extra secureness around that while you have this here. It's a little excessive. It's much easier to just, you know, undrape and needle, but it all depends, like, in your private practice, whatever, but when we're in the clinic and we're like meeting a ton of new people, we don't know them as well as we might know somebody that we've like treated for like 6 months, but maybe you do, you'll slowly, but this is just the best way to start to try and keep people covered. A lot of times where it gets challenging is in pregnant women when you're needling them to do an induction. This is where I've come into a problem with draping, and that is the only time that I have ever just had their whole glutes exposed, like underwear pulled down halfway to get to those points, because they're side lying and that no drape is gonna stay there unless I duct tape it in place. So, um, that is a way where I have had their glutes out. But I think for most women at that point when they're coming to me, they're like, induce me, they don't care about anything. And it's like a very trusted relationship at that point. But this is just the way that I found works pretty good to keep things as secure as we can. Again, if you want to have their back out, you can, for a glute drape, let's just talk about like only needing the side. Or yeah, one side or whatever, or just that. If you want to keep the legs covered, you can. This is where you would have this folded down, straight across.
Do you ever tuck it into their underwear? Is that
I do.
a standard thing? Okay.
I do. You can. Some people feel like a little, you don't know. Is it okay if I tuck this into your undergarments or your pants or what? If you're putting oil on their back, you should try to save their flows. So I put one hand here. This is the glute drape. I make a 45-degree angle. I don't know if you can see that on that. I'll do it on the other side. Okay, holding down here, I'm gonna make a 45-degree little triangle guide. Now, if you just need this for this, or a UB54, that's fine. You can tuck it down here. And then what I was talking about, pulling the excess sheet from the other side up, just to cover that other side with whatever sheet you might have left. Gives you a little more coverage. Once this is there, you can tuck this onto the other side. You can slowly move this over. But again, if you're gonna try and get that, I would do a bottom leg drape, because then this is loose.
Right.
And there's like wind allowed to come in there. So if you really need to get maybe 31 to 34, do a leg drape and then roll it from there. So you have that. But let's say just a GB29 or something on the side. This is sufficient to get these in this area. Any questions on the posterior draping or any comments or anything before I have her flip over?
No.
No? Okay. You want to flip a rooney? Oh yeah, this is okay. So how I would flip, if you can pin this side of the sheet down with your leg, hold this up and have them roll, and then nothing is going anywhere. All right. Let's say you want them completely covered. We'll take a bolster, put that under their knees. The anterior leg is the same as the posterior leg. We take this edge of the sheet here. We're going to make a nice diagonal where we want it to go. Going to reach from inside, grab the leg like so, pull this tight. Not going anywhere. You can tuck this like this. That is how we do anterior leg. You need some upper stomach points or thigh, upper GB. If you want, and you need some of this, or you want to work in this area, you can slowly roll this back. If you need to access around like GB 27, 28, 29, all of this becomes available to you by rolling, and this is very secure in here, like nothing is moving. You can also take their arm, put it over top, just securing both ends of it. So let's say you want to do side lying and you started with this. Say you want to treat the right hip GB30 on the side. What I would have them do, get undressed from the waist down, cover them, like have them be laying like this. I would take this drape, start with the anterior leg drape. I would pull a lot more fabric through. Pull a ton more fabric through on this side. I would take this bolster out. This bolster is going to be under your under your, whatchamacallit, table heater on the opposite side, so it doesn't move. So you have this is your covering. This is covering the whole butt and the whole everything. You're gonna have them roll to the side, roll, 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 while you cover. Place the knee on top of that bolster like so. This leg is straight underneath. You have everything covered. So starting with the draping the leg from the front, very tight, pulling extra fabric through, then you can use that to cover their glutes. Now, if you have a person who has a bigger frame, you might need to use a sheet for this. The gowns work great here, but we might need more. So when you're tucking also, this is a little tip. Don't use your hands like upwards, like grabby. If you put your fingers down and tuck like this, it feels less like you're grabbing there, especially if you're doing under the glute, you want to do that. So then you have this upper portion here. You just pull that tight, you roll back to what you need. You kind of can tuck them into each other and you'll have the whole side glute available to you. Yeah. Okay. And then after you remove the needle, you'll grab it here, you'll have them rotate back, keeping this tight, holding it, and then relax them down. You can lift up, you can undrape them before you leave the room. You don't want to leave people like all wrapped up like a pretzel. Be like, thank you for your time. Have a great day. Yeah, that's a way to do the side lining. Yeah.
So the one that I've been running into the most trouble with is friend 17.
Right.
Just like, sometimes we try to go from below and sometimes we try to go from above. And I've noticed when you lift the shirt up, like, then there's like a bunch of excess fabric that makes it hard to make it a transverse insertion.
Yeah.
And so I feel like if I can, I usually just try to go down like this. But if, say, they have their top off, like, what would you do for that?
Yeah, if they have their top off, like let's say you're like, okay, you got undressed from the waist up. This is what you come into. They're draped, they're covered like this. I would take a pillowcase or a towel or an extra gown or of some sort, and I would cover their chest. Then what I would do is I would slowly start pulling this sheet down. This is the abdomen drape too. Pull this sheet down while keeping this intact. You can do, we'll get to that later. You lift the arm up, over top, lift the arm up, over top. You don't need to tuck this into the sides unless you're trying to get up into the armpits. Then you have a much easier access to just pull down a little bit. Like you can put this lower, as low as you need without exposing. And then you just have a little bit of fabric to pull rather than a whole, crew neck collar to try and get down.
Okay.
That is my experience. We can also pull this up if you need liver 14 right here, right here. This just keeps it draped. Let's say you want to get into these side points. If you want to get heart 1 or any of this inner arm here, you would take this, a tight tuck with your fingers just underneath. And then you can have them relax the arm up here. Everything's covered and secure and tight. If you want to do a spleen 21, this is where I would take a larger, I would open this up, I would tuck some under the top shoulder and then kind of roll. It would just be a little bit, there's not much securing you can do here. It's a little challenging sometimes using an extra towel maybe to keep, but if someone doesn't have a bra on or you're trying, most likely you can't where that location is, just having something secured. You could also lift up and try and have it tucked up this way and then roll, like almost fold it.
It feels pretty tight.
Yeah, if you go under the armpit and you roll the bottom, almost like you're trying to create a sort of support for the breast, if that's the issue you're coming in contact with, and then you have pretty decent access to those areas. As far as the abdomen then goes, after you have pulled it out from the sheet, you don't pull this down to fold. You want to try and keep like this available and then fold down. That will give you then the same as the posterior side. You're going to reach across and tuck under the hip tight. Reach across, use your fingers like this and tuck under the hip very tightly.
Sophie,
Yeah.
how did you do that side? This way?
I went like this.
Okay.
Lifted. It's, if you're trying to stay on
Okay,
one
I
side of
just
the
wanted
bed.
to make sure, like,
In massage school, they taught us do one side, then go and do the
oh,
other side.
okay.
But do I do that? No. But this is like, yeah, they prefer you do it like this with your hands on the table rather than upwards. Because it doesn't feel grabby. This you can also, if they have undergarments or pants, you can tuck it in. Just be mindful how low you're going. Let's say you need to access like here, and you just are keeping the legs covered. You're not doing an anterior leg drape. You can fold this over, but you would just tuck it. Try to like, and then you can also just like the glute pull this side up. But if you're doing both sides, again, this is available to you to have like this type of drape, but sometimes just putting a little extra pressure, like heavier covering, just to keep it secure. That's just an option if you need to get that. The hair draping, we don't have a headrest cover, but I can show just a little bit. You want to flip on over?
I've been running into this with cupping a lot recently.
Yeah.
Oh, should have had them like tie it up a little more.
So let's say you have a lot of hair, which she does. You're gonna pull it all. You can put your hands under your head, like
Oh, okay.
yes, perfect, like on your forehead. So you're gonna pull all their hair forward and tuck it. Like imagine you're tucking your hair behind your ears when you're doing it like this. You're gonna tuck it behind their ears here. So that creates a little bit of security. But then you're gonna get all the little hairs because that's what likes to get stuck in the cups. Take pillowcase is perfect size, or a hand towel about this size. You drape it over their head. You pull it tight. I don't know if you can see this, but you're pulling it tight at the nape of their neck. And then if there was a headrest here, I would be able to twist this around the hair and like tuck it in, like to the hole that their face is in.
Oh, it's above their head.
Like, so imagine you're
on top of the head.
no, on the sides. So you know how the hole goes all the way around? So you're pulling this, you're pulling all the hair and you're tucking it like that.
Oh,
Making it tight. You don't even need to tuck the top part in. Like that, yeah. Yes. That is all I have. If you want me to go over anything else, let me know. I don't know. We did the best over Zoom that we could. And yeah, if you guys, I think they're gonna try and create like some sort of sign up thing if you want to practice. Because a lot of people had to do it over Zoom. Oh, hi Ian. Another massage therapist who knows what's up.
You did great,
Yeah.
Sophia. Thanks so much.
You're very welcome. Yeah, any questions, feel free to reach out. And we might schedule something else to practice in the future. I don't know yet.
Yeah,
I'm-
great job. Always good to see the diaper broken out.
Diaper drape is the best for the win. Okay.
Maybe we could also look into some tractions, like using sheets and pillowcases and stuff like that, and show how to cradle limbs and do stuff like that.
And that could be part of like I don't know, like orthopedics, like learning how to do stuff with sheets.
Mhm.
Always
I'm down.
cool. Yeah, all right. Yeah. Feel free to reach out. We'll see if we need to have another session to like if anyone that wants to practice can all come in and meet up and we can do that.
One little piece of feedback, Sophia, for future ones.
Yeah.
If you're not able to set up in a room and show people, is
Mhm.
you could just show either this clip of this video, you
Mhm.
know, clip,
Yeah.
take it out and just insert it as like as a YouTube or something. Then people can take it and then people can take that piece home too and like go over it or whatever.
Yeah,
Um,
I don't know if it's like a good enough view or not,
Yeah,
but
or you could make it, set it up even nicer and do a YouTube clip, basically.
I'm gonna stop recording. Hold on. Is it recording?
Yeah, I was like watching.
All right. Thanks.
No. Okay. Yeah. They were asking me to do a full make a whole thing, but I don't know that I'm gonna do that. So this might just be a class that you guys that the new incoming interns will take with someone else because I am moving. I don't know if I told you guys, but yeah.
Where are you moving?
Wisconsin.
Oh my goodness.
Yeah. We're heading
Yeah.
out
Yeah. And when are you leaving?
April 1st. Very
Going into
soon.
spring.
Yeah. Avoiding the winter, but alrighty. I don't know why I can't. I'm gonna figure this out. You guys don't have to stay anymore. I'm gonna figure this out. Okay. Bye.
Is your family there?
I do have some family. Yeah. Bye-bye.
Oh, bye. Sorry.
Have a great day.
Have a great day.
Thank you. You too.